Welcome to Police Headquarters. I'm going to take a moment to introduce everyone who is up here because I think it's important that you realize how people have gathered for this crisis. Our Chief of Staff to the Mayor Harp, Tomas Reyes, is here. Dr. Martha Okafor is here. Dr. Kennedy is here. The United States Attorney Deirdre Daly is here. DA Agent in charge of Connecticut, Agent Boyle, is here. The Director of Emergency Management, Director Fontana, is here. Assistant Chief Maccarelli is here. Assistant Chief Generoso, Assistant Chief Campbell, and Assistant Chief Casanova of the Police Department are here with me. I reached out last night and this morning and spoke to the President of the Board of Alders, President Walker, who is trying to get here, but has been fully briefed on the matter. Senator Murphy's office is here. Congresswoman Rosa DeLauro's office is here. Both commissioners, my chair, Commissioner Dawson and Commissioner Ribeiro, are here. Dr. D'Onofrio of Yale is here. And the Housing Authority Director, Karen Du Bois-Walton, is here, along with the Director, Mike Briscoe, of Communications. So we have all gathered here for this crisis. I'm going to take a moment to talk about last night and turn it over to my colleague in uniform, the Assistant Chief of the Fire Department. In the last 24 hours approximately, we've had 16, if not more, overdoses in the city of New Haven and lost 2 of those 16. Last night when I responded to a call for 2 people dozed off in a car off of Bowen Field, I watched police officers and firefighters bring people back to life with Narcan. It was extraordinary. And not 100 yards away, in another car in the same parking lot, 3 people were dozing off, overdosing, and the police and firefighters saved all their lives. It was proud to see this uniform in action, and I congratulate the fire chief. And I congratulate our own officers who were saving lives last night. But that overdose attack began earlier in the day in New Haven and went well into the night. So last night we all spoke and made a decision to call a public health emergency, to put out a press conference now, to put out a press release last night, to activate Everbridge, to contact the emergency rooms. We need to save lives in New Haven. We need to save our own people's lives. With that, I'm going to introduce my brother in uniform, the Assistant Chief of the Fire Department, Chief Maccarelli. I will then introduce others, and then we will be open to questions. Thank you.
Thanks, Chief. I'm Assistant Chief Matt Marcarelli. I'm the Operations Chief for the Fire Department. So my comments will be limited to what our department did yesterday. So our company started to respond to what they suspected were overdoses starting around 10:30 yesterday morning. We had a few that were individuals that were exhibiting the signs and symptoms of what our firefighters and paramedics and EMS personnel are trained to recognize as an overdose, and those patients presented with in respiratory arrest, meaning they were not breathing. And based on those signs and symptoms and how the patients presented, they administered our antidote kits that all our firefighters are trained to administer. However, around 3:30, we started getting calls to the 911 center for multiple patients in the New Hallville area primarily, where firefighters were faced with 2 and eventually 5 patients at the same time, all exhibiting those same signs and symptoms. All of those victims were administered antidote kits. Some were given 3, 4, and 5 doses of the antidote kit to attempt to revive them. 2 of the victims that we treated were in cardiac arrest, and they were transported, all the victims were transported to the hospital. 2 were transported in cardiac arrest. Going forward from here, we started to slow down around 10 o'clock last night, where the events started to subside. We worked with our public safety partners to make sure we were getting the message out that there was definitely a problem out there one way or another. We wanted to make sure that we were we had with us enough antidote to get us through the evening. So we reached out to some of our public safety partners in the Hartford area, the pharmacy at Yale New Haven Hospital, American Medical Response, to ensure that we had enough dosages to get us throughout the night, because whatever the product was that we were dealing with was stronger than what we were typically encountering. So we have enough antidote on hand. All of our fire engines and paramedic units have antidote kits, which contains Narcan or naloxone, and we should have enough to get us through until we get another delivery from our pharmaceutical provider. That's it for the fire department response. Just want to say that our personnel, they saved a lot of lives yesterday. They did an excellent job with their partners in EMS from American Medical Response, and they should be commended for their efforts.
Thank you, Chief. I'd now like to introduce the United States Attorney for the District of Connecticut, United States Attorney Deirdre Daly.
Thank you, Chief. So there's not a lot that I can say because this is an active and ongoing investigation. But like Chief Esserman, I would like to thank everybody who responded yesterday. The Fire Department, EMS, New Haven, Police Department, and the DEA. Everybody is on this, and I want you to be assured of that. What I can tell you is that the investigation to date has shown that a number of these victims thought that they were buying cocaine. They did not think they were buying heroin. And as you all know, the tragic deaths that we have seen throughout Connecticut and throughout our nation have been heroin overdose deaths. So this is new, and I want cocaine users to be forewarned. When they think they are buying just cocaine, they are not in these cases, as we have seen yesterday. That cocaine that they thought they were buying, in fact, was a lethal opioid. And we've had 2 deaths here and 13 other serious overdoses. So again, I want to thank the team here, and I'm very happy that Dr. D'Onofrio from Yale is here, because she will speak to this further, because this is really a public health and a public safety issue. Thank you.
Thank you. I'd like now to introduce Dr. D'Onofrio from Yale. Thank you. Thank you, Doctor.
Good morning. So I will echo what everybody else has said. We cannot say enough about our first responders and the fire, police, and EMS who have helped save the lives of many of these patients. We had over 20 patients who came to both of our campuses, St. Raphael campus and York Street campus, 2 of which we were unable to save. The most important thing is that you know that we are in this epidemic of heroin overdose throughout the country and in our state. We have tried very hard to do a strategic plan, and we are working with the governor's office and everyone in this room with that initiative that is ongoing. The most important thing about this is it sort of highlights all of our issues and where we need to work harder and in our public messaging. These overdoses were probably a synthetic opiate called fentanyl, but we don't know that for sure. We are waiting till this afternoon to get confirmation. That's probably why it took so much of the Narcan or naloxone, the antidote, to enable to reverse it, because it's 100 times more potent than heroin. But what I have to say is it wasn't just that drug or that combination was something else that we called an adulterant. It was something mixed with that is causing havoc with patients' lungs. So we are waking them up, the ones that survived, and we were able to talk to them, and they think that they had taken cocaine, but they were unable to oxygenate. Their oxygen levels went down very far, they were breathing very heavily, and they needed to have artificial respirations in place, and they are now, several of them are now on machines and in our ICUs. So this isn't just fentanyl. This is something in combination with that. And so I am really need to get the message out to those patients, those people in our community who are using drugs. This is not what you've seen before. This is not, you can't say that you know how much to take. This is unknown. It doesn't have an FDA approval on it. It doesn't have a dosing range. So that everyone needs to be careful and not use this. If they do have this substance on board, I'm sure that there are some people here who would like to have some of it, so we can actually identify what those substances are, but right now we don't know, and everybody is at risk. So that if you are using, I just want you to know we have plenty of opportunities for you to get in treatment. You can come to our emergency department. We have other areas here in New Haven that can help you, and we would appreciate your reaching out to us because we are here to do that. The emergency department is a reflection, it is the front door of the community, and unfortunately we are always sitting here at the front lines and seeing things that have happened today. But we are here to help, and we will encourage anyone who needs treatment to contact us. Thank you.
Thank you, Doctor. And lastly, before I come back to the podium, I'd like to introduce our Dr. Martha Okafor. Thank you.
Good morning, and it is really with sadness that we all gathered here because of the incidences that happened and the death of our residents in the city. This has also enabled us to move into action immediately, as you heard. Both our police, our emergency department, the fire, the DA office, and Yale, and our health department, we've been working on addressing this issue. Our public health department actually released the Narcan that we have to our emergency operations this morning so that we will supply and augment the Narcan that is needed to put together the tool in case we have new incidences that will occur. At the same time, we have a meeting, that emergency healthcare capacity meeting that we've called at 2 o'clock today, involving both Dr. Denofrio from Yale, our fire department, our police department, and the healthcare capacity we have in the city, which includes our APT Foundation and Cornell Scott Federally Qualified Health Center, so that we can create the enough capacity in order for us to triage and receive people in case we have further incidences. The city is working very diligently to create a referral and triage flow that will enable us to actually help people if there is new incidents. And I want to emphasize again, if you are using a substance, please beware. Do not take any of these substances out there. It is something new. It is adulterated. It's synthetic. There is no dosage aspect of it. The most important thing you can do is do not take any of them. It is not your typical cocaine. It's not your typical heroin. If there is any way you took any of them and begin to feel abnormal, please get to the emergency room so that you will have an immediate treatment, and we will be following up on next step in terms of how to engage the public on this issue. And we have Dr. Kennedy here with us as well, but we will be here to work with the team. Thank you.
Thank you, Dr. Okafor. So before we open it up to questions, I just want to repeat, this was a long day yesterday for New Haven, and a long night. And now we're asking for your help. New Haven police officers and firefighters, AMR, Yale doctors did some remarkable work over the last 24 hours to keep New Haveners alive. We now need to communicate to the community to be aware, and we need their help. And we're grateful that all the press are here today to help us keep New Haveners alive. And with that, we'll turn it over to questions.
Chief,
I know you mean the fire chief, right?
since these patients report they thought they were buying cocaine, were they snorting this drug? How were they taking it that led to these overdoses?
Excuse me, could you step up to the microphone? Sure. Yeah, and none of that can be confirmed. It's not typically what our firefighters encountered when they responded to these calls. All I can tell you is that what they did exhibit were the signs and symptoms that prompted them to administer the Narcan antidote kits.
Just in an emotional sense, what did a day like yesterday, what type of toll does that take on the men in your fire department to go out there and see these people almost near death?
Well, dealing with overdoses is nothing that's new to our personnel in the fire department. However, the volume and the short time span that we had so many of them was what was the real issue for the fire department. It taxed our resources.
Chief Marcarelli, are you concerned at all about this weekend if another similar rash of overdoses breaks out? I know I think you said you have enough supplies
Well, it seemed that it slowed down after we got the word out last night. We only had possibly one this morning at around 8 o'clock, but that's not confirmed yet. But what we did is to prepare for the weekend is we made sure that we had enough supply on hand. So we reached out to some of our partners in the business to make sure whatever supply they had that they could spare, they could send it our way in the event that we needed it.
Fire department bringing on any extra guys to deal with potential increase in medical calls?
No, that was, it was not anything that we were not prepared to handle with the existing personnel.
Any information on the fatalities in terms of their ages, genders, do you know anything? You can tell us?
I don't have any of that information.
The age of these patients, were they across the spectrum? How old were they?
They ranged from the spectrum of the 20s into the 40s.
For investigators, is there anything that's sort of on the bag, if it was like a stamp, a color of a bag, anything that you're able to get out there so folks know in other areas?
The investigative work is something that we always stay very silent on. When we balance it with the public health, we will get out any of that information that could help save lives.
But I mean, if it is killing people and injuring people.
I'll leave it to the detectives to let that news out through David Hartman within the hour.
Dr. D'Onofrio, would you mind explaining a little bit more about fentanyl? We hear about it so much. We hear it's 100 times more potent than heroin. What is it as it relates to heroin, and why has it become, the additive of choice, I guess?
Fentanyl is a synthetic opiate, so it is made in the laboratory, and it's being made in China and in Mexico, and probably going to be shortly here. It's very inexpensive to make because it's not a natural plant like that you have to grow opium. So it's cheap, and unfortunately very, very powerful. So some users may want to use it because they can use small amounts and get very high. The problem is, and people are selling it and making lots of money. So the drug trade is making tons because they can take what they normally would find in whatever, however they sell it, in bricks or whatever, and they can actually cut that down like zillions of times and sell it for the same amount of money. So whatever they were making, they're making 10 and 20 and 30 times more with fentanyl. So it's very scary, and it's all a white powder. People don't know what they're taking, and that's the big problem. We can't even test for it. There is no dipstick for it currently. Even in our hospital right now, we send it out. It will not show up on your classic drug screens. So we're all been scrambling to work on that, but that's what it is. And we use it. It's a very potent drug that we use in the emergency department for pain control in certain circumstances, particularly around procedural sedation when we need to put a hip back, put a shoulder back, because it's very quick acting. It only lasts for a short period of time, but we do it under very strict conditions, and we're always managing the airway. So the public doesn't understand this. They don't understand how you can literally die. And these patients who we have interviewed, some who thought they were taking cocaine, were naive to opiates. So it's not like your general user who could maybe survive fentanyl because they have a high tolerance. These people were not tolerant. So any bits of it could put them into respiratory rest, which is basically what's happened.
Dr. D'Onofrio, when there's a public health emergency on the hospital and kind of what happens there with everybody coming together, what's the response like to that?
So again, we work with our pre-hospital providers, and they keep us alert. They know that people are coming in. They know there's a problem. We then, if we need extra personnel, we can bring that in, and we're very capable of doing that 24 hours a day. We have doctors and nurses who are on call. They called people last night. They were able to handle it with what we had, but we had people ready to come in. We will always be able to do that. And we have great communication with everyone, so that's the nice part of being a very big team approach.
In typical overdose situations, when you're talking about heroin and even with fentanyl, do the lungs typically fill up with fluid, or is that what makes you think that there's something else going on?
There is a response to heroin that sometimes will happen even with naloxone as well, that people will get this response of almost like pulmonary edema or heart failure, but it's not your heart, and it fills up with fluid. Sometimes that happens, but not for it to happen in such a huge, like everyone. So it's a response that rarely happens, and now it's done it with everybody, with most of the patients, and that's why we admitted quite a few. And it just doesn't look like your typical, it looked like there was more an irritant to the lung itself. So that if these were nasally, someone asked that, a lot of them were nasally ingested. So it went directly into the lungs, and there was something in there that was a real toxic substance to the lung, besides the opioid.
Thank you. So we will make ourselves available individually. No one's leaving the floor. But again, I want to just ask the public through the press, let's keep New Haveners alive. Thank you.
Stand by 1 second, please. We have some more information. There is an anonymous tip line number that folks should have if they want to call and provide information to the detective division about drug sellers and drug users and so on and so forth. The number is 203-946-6098. It's 203-946-6098, and those calls can be made anonymously.
Thank you.